85,000 Japanese showed that females with more than 20 teeth had 30% lower mortality risk than a female who had a smaller amount of teeth. Similarly, males with 20 teeth or more had a 42% lower mortality risk than did males who had no teeth. Similar findings have been observed in US, Danish, and other Japanese populations.
Welcome to Longevity by Design, a podcast designed to give individuals access to the leading scientific information in the field of longevity. The ability to add years to your life and life to your years needs no opinion. Join us as we ask science to take the wheel. In each episode, Dr. Gil Blander joins a co-host and an industry expert in the field of longevity, shining a light and getting the answers to the key question: how can we live a longer, healthier life?
Hello, I'm Ashley Reaver. Welcome back to Longevity by Design, How to Live a Longer, Healthier Life. We're produced by Inside Tracker, your science-based guide to optimizing your body from the inside out. Today's episode is an Ask Me Anything between Gil and I. We've gathered questions from our interest in the topic of oral health, health span, and longevity, and we're excited to discuss answers to these questions together. Obviously, Gil and I are not dentists, we are scientists. We're not providing medical advice, but hopefully this episode encourages you to take care of your mouth and visit your dentist regularly. Welcome, Gil.
Welcome, Ashley. So where should we start?
What is the reason behind this topic that we're bringing to our second AMA now?
Yeah, that's a great question. And actually, it's coming from a pain point that I have. So I have a horrible oral health issues. I think that it's genetics because my parents and my sibling have a similar issues. I think that I'm spending maybe $5,000 a year at the dentist office, and I have a frequent flyer at the dentist office as well. I visit there like at least once a month, if not more. And it's bothered me so much. So I decided to start looking into that and understand what can I do. And also I become worried that maybe it will influence my health span and lifespan. So I started to research it, and also our amazing producer did that, and yourself as well. And we started to realize that there is a lot of what to know and understand about oral health and longevity, and also health span. And we also assume that I'm not a unicorn. And maybe a lot of other people have a similar issue. So we said, why not? Let's research it and provide some information to our audience about oral health. So that's the reason, and I'm very excited about that. And maybe, Ashley, you can start by defining what is oral health.
Sure. So oral health refers to the condition of your mouth, certainly includes your teeth, your gums, and other structures that you find in that oral cavity. Oral health is not just preventing cavities, although that's certainly very important, but also about promoting healthy gums, the freshness of your breath, maintaining enough saliva production. And we'll talk more about what saliva does a little bit later. And then proper usage of your teeth. So being able to eat and chew and swallow all of those things that we hope we can accomplish with our mouth. In 2016, the FDI, World Dental Federation, approved a new multifaceted definition of oral health, which is very nice. It encompasses a lot of things. So they define it as the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. A lot of words there, but I could say them because my oral cavity works. So how is oral health, now that we've done all of this research for this podcast, fueled, of course, by your own curiosity, how is oral health connected to health in the rest of the body, even into health span and longevity?
Yeah, so as you mentioned, the definition of the World Dental Federation noted that oral health is an essential aspect of overall health and well-being, whereas poor oral health can lead to various problems, and those including cavities, gum diseases, loss of teeth, and bad breath. Now, poor oral health also linked to more than 50 systemic health conditions, including Alzheimer's disease, cardiovascular disease, diabetes, and respiratory issues. Interestingly, the link between oral health and a systemic condition can be microbial, inflammatory, or combination of microbial and inflammatory. Additionally, poor oral health is associated with decreased health span and lifespan. And actually, the result that I'm going to describe right now are really astonishing and amazing. And I'm feel bad that I haven't learned about them before, because everyone that interested in longevity and health span should know them pretty well. So there are numerous scientific studies showing that those with fewer teeth are at increased risk of death. And there are a few examples for that. One study that they've done in Japan on a big population, around 85,000 Japanese, showed that the females with more than 20 teeth had 30% lower mortality risk than a female who had a smaller amount of teeth. Similarly, males with 20 teeth or more had a 42% lower mortality risk than did males who had no teeth. Similar findings have been observed in US, Danish, and other Japanese populations. So again, very strong correlation between the number of teeth that you have and the longevity. Again, I don't think that if you have less teeth, it's immediately you are doomed. I think that the reason for that is it's hard for you to chew. You feel bad. You don't have a lot of social events. Also, it's very harder for you to find a job. It's harder for you to be influencer. And because of that, you basically the secondary effect of that is that you live shorter because you have a gloomy life, how to chew and how to nourish your body, and because of that, you live shorter. Another interesting paper that follow a US cohort for 15 years compared again a group with more than 20 teens with a group that have lower than that. And they found that the mortality risk for the group with less than 20 teeth was 2.1 times greater than the group that have more than 20 teeth. And now you need to understand that there is no any nutritional intervention that show 2x effect on longevity. So we are talking so much about nutrition and all of that, but if we think about the dental health, is even more important than all the specific intervention that related to longevity. Some exercise intervention did have a hazard ratio that is higher than 2. Definitely smoking and BMI are, but this is very important. It's really surprising and exciting to know that keeping, and maybe scary for me, for keeping a good dental health related to longevity.
I was surprised by 2 times as well when I heard that number because we're, so excited about 10 or 15%, but 200%
Exactly.
is pretty intense.
It's really everyone that listening, you need to remember this is serious. It's not a joke, and there are a lot of papers. It's not like one paper that was published 50 years ago. Those are good papers that publish in different countries, analyzing data from different countries such as US, Japan, China, Sweden, UK. So it's not only one location, one group. It's a pretty good studies, and I tend to believe the data. Now, recently, a team in Japan coined the term oral frailty. And what is oral frailty? Oral frailty is a new concept that was introduced, as I said, in Japan in 2013, related to oral function. As of 2020, oral frailty is defined as a series of phenomena and processes that lead to changes in various oral conditions, number of teeth, oral hygiene, oral function, etc., associated with aging and accompanied by decreased interest in oral health, reduced physical and mental reserve capacity, and an increase in oral frailty, leading to eating dysfunction. The overall effect of decreasing physical and mental function. So again, very interesting discovery, and oral health is strongly connected to longevity. So now I want to ask you, Ashley, what is the oral microbiome and what should we know about it?
So the oral microbiome really refers to the complex and diverse community of microorganisms that live in our oral cavity, not just in our mouth, but that also includes our throat. This microbiome has lots of bacteria, but also maybe viruses, fungi, other microbes that really form the ecosystem that changes and hopefully, ideally, as we'll talk about it, is pretty well balanced. And the oral microbiome seemingly plays a pretty crucial role in maintaining that oral health, as well as being important for overall well being. And if you've never thought about your mouth's microbiome, you're not alone. We hear so much about our gut microbiome. But, tomorrow morning after listening to the podcast, wake up. If you run your tongue over your teeth and they feel super slimy, congrats, you've just discovered your mouth's microbiome. That film that forms over your teeth is really from those bacteria that live in your mouth. And that's why most of us need to brush our teeth pretty soon after waking up in the morning. So it is there. And I was mentioning to Gil, I think your oral microbiome is kind of quite a few years behind where the gut microbiome was or where the gut microbiome is now. It's like new and exciting. And, there's a lot of research that is being currently done about it. Some key points to know about the oral microbiome. There's over 700 different microbial species that have been identified in there. So we want to keep a really diverse environment. They all contribute to the stability of that environment, as well as resilience against bad actors, perhaps, in that environment. Balancing of those 700 microbial species is important. Healthy oral microbiome is characterized by a balanced and harmonious relationship with all of those different species that we have. And disruptions in that balance can really lead to oral health issues, cavities being a big one, periodontal disease, gum disease, which we'll talk about quite a bit today, as well as contributing to that bad breath and those slimy teeth. And as I said, it's pretty new research, just like that gut microbiome. There's not a ton of concrete evidence on specific strains of bacteria or types of microbes or treatments to really change that. But just like your gut, trying to encourage diversity there and not allow one type of bacteria to become the overwhelming majority is important. Some functions of your oral microbiome and performs a lot of important things, certainly can help with digestion since it can contribute to the gut microbiome. Those microbes on our teeth, certainly we can swallow them and they can be introduced to our digestive tract. And our microbes in our digestive tract are certainly incredibly helpful for helping to digest dietary fiber. They can defend against certain pathogens. They can also contribute overall to the development of the immune system. And then some bacteria in the oral cavity are also beneficial in general, just for healthy or just for oral health, I should say, maintaining oral health. For overall health, the oral microbiome is increasingly being recognized for its impact on overall health. Like I mentioned, imbalances in the oral microbiome may be indicative of overall oral health, which has been linked to various systemic conditions like cardiovascular disease, diabetes, and even respiratory infections, as you mentioned before. And then hygiene and diet. Obviously, good oral hygiene practices like brushing your teeth regularly and flossing regularly, especially before you go to bed, are your best bet for maintaining a healthy oral microbiome. Diet can also play a role, and we'll go into that a little bit more later. Most importantly, just watching your intake of simple sugars um, likely has the biggest impact, which we all know, it's been drilled into us for a long time, can also be key for avoiding cavities. And then I threw in here again, just going to see your doctor regularly or your dentist regularly, once or twice a year or more if that's what it is necessary, especially if you notice any bleeding in your gum. And then research on the oral microbiome is ongoing. We've got lots of interesting studies that are going on all around the world, like some of those studies that you mentioned before. Researchers are continuing to investigate the connections to various health conditions and the oral microbiome. At this time, we really just know that it exists and it's probably important, but currently, don't spend your money on probiotic mouthwashes, toothpaste, chewing gums, tablets, anything like that. We don't have any research to support that yet. Maybe in the future, but not currently. But that was a lot of info on the microbiome in your mouth. if you didn't know that one was there. And pivoting now kind of to the relationship between oral health and cognitive health, which is something that I also didn't know until doing a lot of research into this topic for the podcast.
Yeah, I was also surprised about that. And actually, there is a bi-directional relationship between oral health and cognitive health. And similar to the microbiome, the mechanism are not fully understood. What is known, the data show that poor oral health, specifically periodontal diseases, is linked to two-fold increase in the risk of developing dementia and 1.5-fold increase in the risk of developing Alzheimer's. Again, it's huge. It's not a joke. It's a 2x or 1.5x. It's very strong. So suggesting that everyone that worry about dementia, Alzheimer, or any other cognitive disease should take it very seriously. But in the other direction, if you have dementia or Alzheimer disease, you have higher risk to have poor oral health. And I assume that that's because you are tend to forget to brush your teeth, you tend to forget to take care of it, and basically the bacteria that Ashley described before can have a party without you controlling the party. So it's like a college kids that staying at home for a week and the parents are not around, and you come back and you see a lot of buckets of beer and wine and whatever in living. So that's in my opinion, that's the reason for that. There are a few key points regarding the relationship between oral health and cognitive health. First is inflammation. Chronic inflammation have been identified as a common factor in both oral health and dementia. Particularly gum disease and inflammation in the body, including the mouth. Many contribute to systemic inflammation, which is associated with cognitive issues. Also, periodontal diseases can contribute to cognitive decline. And some studies have found association between periodontal gum diseases and cognitive decline. Chronic gum inflammation may release inflammatory molecule that could reach the brain and contribute to the neurodegenerative diseases. Again, nobody understands how, but that's the assumption today. As Ashley discussed before, we have 700 kinds of bacteria in our mouth, and there are some evidence that's starting to appear that oral bacteria and their byproduct may potentially enter the bloodstream and reach the brain, and that's my impacting the cognitive function. Again, the mechanism is not clearly understood, but a lot of scientists are trying to understand it. Now, interestingly, both cognitive diseases and oral diseases share a lot of risk factors such as age, diabetes, and cardiovascular diseases. And because of that, it could be that because they have a similar risk factor, there is a connection between them. But again, it's not clearly understood today why. And last but not least, there is a correlation, similarly in what we have seen for longevity between tooth loss and cognitive function. And some study have suggested a strong correlation between tooth loss and cognitive decline. There is a meta-analysis study that was published in 2020 and includes 356,000 participants and showed that those with greater tooth loss were at increased risk of cognitive decline, dementia, and Alzheimer. So again, there is a lot of correlation between those two issues, but the mechanism exactly is not clear. And if we discuss dementia and Alzheimer, is there any relationship between oral health and cardiovascular diseases, Ashley?
Yeah, I think this one's probably been around for a little bit longer, more understood, or at least more recognized. The relationship between oral health and cardiovascular disease. It's definitely been the subject of research for a while, but there's not been a direct cause and effect that's been established, although there's definitely evidence suggesting a potential association, in particular around inflammation that can happen with gum disease, as well as that oral bacteria if there are cracks in your gums entering into your bloodstream and causing some impact. So, some key points regarding this relationship again, inflammation being a really big one. That periodontal or gum disease is a chronic inflammatory condition that causes really bacteria to accumulate and can result in a lot of that dental plaque, as well as the, again, bleeding in your gums. And this association, even, or excuse me, the inflammation, even though it starts in your gums, it doesn't stay there. So it's linked to systemic inflammation. And actually, when I started working at Insight Tracker 8 or 9 years ago, when we were looking at causes of elevated HSCRP, having gum disease was something that really could cause that marker to be high for individuals. And that marker is, one way to show that there is inflammation happening in the body. And that inflammation is really, really key is crucial in developing cardiovascular disease. Bacterial presence is another one. So the oral bacteria entering into your bloodstream, potentially through those cracks in your gums, especially again for individuals that have gum disease, or for people while they maybe are flossing or brushing. Once that bacteria is in the bloodstream, they can act just like other bacteria. So they might cause an immune response, which is going to cause kind of a cascade of events. Our white blood cells will come out. They're going to be activated. Elevated levels of these white blood cells are also a contributing factor to the formation of plaques in our arterial walls. In particular, one type of white blood cell called monocytes are what specifically invades our cell wall, forming foam cells that can contribute to those plaques forming in our blood vessels. Those plaques are ultimately what leads to atherosclerosis, the condition of building up of those plaques in our arteries. And that atherosclerosis, again, a key factor is one of those key factors in cardiovascular diseases like coronary artery disease. And that inflammation is really a key piece of that atherosclerotic process, along with cholesterol. But that poor gum health, again, can cause inflammation in your gums, but that inflammation doesn't just stay there. It can go throughout our whole body, really fueling the development of these plaques. Endothelial dysfunction is something that may happen. And endothelial dysfunction is really impacting the lining of our blood vessels. It is associated with impaired blood vessel function and also considered a pretty early step in the development of cardiovascular diseases. Again, some early research showing that maybe there's a link between oral bacteria impacting the function of our endothelium. And just like you mentioned for dementia and Alzheimer's, there are shared risk factors between poor oral health and cardiovascular disease. Individuals that smoke, have diabetes, perhaps poor dietary habits are definitely going to be at risk for both of those things. I also think it's important to state that maybe certain life circumstances or lifestyle factors like lack of access to healthcare, healthy foods, leisure time for being active definitely are important things to address as well, as some of the shared risk factors between both of them.
That's amazing that so many diseases are connected to oral health. So, what about diabetes? Any connection between oral health and diabetes?
Yeah, similar. Again, it's kind of bi-directional. Just like you talked about for Alzheimer's, it does seem that individuals that have diabetes are more likely to have poor oral health. And the reverse is also true. Individuals with poor oral health may notice impaired glucose levels. So their blood glucose levels may be increased. Hemoglobin A1C may be increased. And one of the things, while we were researching for the podcast was also that medications to help diabetics may also not be as effective. So some key points related to the relationship between oral health and diabetes: super strong connection between diabetes and periodontitis or gum disease, periodontal disease. There we go. Individuals with diabetes are at an increased risk for developing it. Untreated gum disease can make it definitely more challenging to manage those blood sugar levels as well. Inflammation, both diabetes and gum disease involve inflammation. That chronic inflammation in the body, just like for cardiovascular disease, can affect the development as well as the progression of diabetes. In turn, diabetes can also contribute to exaggerated inflammatory response, which can potentially make gum disease worse. Poorly controlled diabetes can certainly or obviously can lead to high blood sugar levels, which can further promote that bacterial growth and increase the risk of certain gum disease, as well as potentially cavities. Treating and managing gum disease also is something that can contribute to better blood sugar control in individuals with diabetes. Research has shown. For oral infections, diabetes can reduce the body's ability to fight infections generally, and that includes infections that we have in our mouth. So, this makes individuals with diabetes potentially more susceptible to those oral infections, including infections that we can have in the gums. And this one I thought was interesting. Dry mouth diabetes, as well as some medications for diabetes, can contribute to dry mouth. Reduced saliva flow is something that can increase the risk of cavities, as well as other oral health issues because our saliva has all sorts of things in it. It helps to neutralize some of the acids that we find in food. It obviously helps to lubricate and moisten food as we're eating it, help to swallow it, but it also washes those food particles away from our teeth and can help to prevent some of that overgrowth of harmful bacteria. It also contains lysozymes, which are immune factors that, our mouth is kind of our first line of defense against eating things that can potentially cause us harm. So low levels of saliva can certainly influence our oral health as well. And then again, shared risk factors, just like we talked about for Alzheimer's, dementia, and cardiovascular disease. Smoking, poor diet, and again, lack of access to regular dental care or healthcare in general are all things that can influence both of them. And one thing I would say is super crucial for individuals with diabetes to be proactive in managing their oral health, working really closely with both their dentist and their healthcare provider, maintaining that good oral hygiene practices, managing blood sugar levels, and seeking treatment for any oral health issues are really essential components of overall diabetes care. Just like, you may also start taking better care of your feet. Same thing is true of your mouth. And one thing I think is interesting is that including your doctor, not just thinking of them taking care of your teeth, but thinking about them as part of your larger healthcare team. They may be the ones that identify that you do have more inflammation in your mouth. So it might be worth talking to your doctor about diabetes, really going to get a checkup maybe on your cholesterol levels to see how it is influencing your overall heart health. And I can remember learning at school a long time ago that dentists are really some of the first people that may recognize that individuals are struggling with bulimia, a type of eating disorder, as the acidic food from our stomach comes up and starts to erode some of our teeth. So your dentist is definitely a part of the big overall healthcare team, not just someone you might see once a year to help with those hard things sticking out of your gums.
One comment about that, Ashley, related to prevention versus treatment. So a lot of us are not happy with the healthcare system that basically it's treating the disease, and someone that is not sick, like hopefully all of us, are coming to the clinician and is basically kicking us out of the office. We say, hey, you are healthy, go home. And we want to be even better and optimize. While when you think about the dentist, a lot of the work that they are doing is prevention. They are scanning your teeth with their eye because they can see it, and they coming with, hey, let's monitor this tooth because there is something, but just monitor, and hopefully if you brush it better, it will be better. You have the hygienists that they help you to clean it and make it better. So I think that in a way, I haven't thought about it before, but preparing to this episode, the dentist is more in the side of prevention than only treatment, like what we see in the, let's say, the American or the US healthcare system. So it's very encouraging that they are trying to help us to prevent diseases and live better longer in a way.
And when I went to the dentist last month, they actually started taking blood pressure. I'm sure it's perhaps because they can then bill insurance to take your blood pressure, but I was super excited that I had one more
Yeah.
checkpoint in the year, just, on my blood pressure to make sure I was still okay. I don't know if something happened that triggered that, but I was happy that it happened for me.
No, it's as I said, I'm a frequent flyer at the dentist office, and they are doing it in the last few years. Yeah, they are measuring your blood,
Gotcha.
and I agree with you. I'm every time that they're doing it, I'm entering it into the right application to maintain it and basically monitor my blood pressure. So it's definitely very good that they're doing it.
As a Longevity by Design podcast listener, you understand the value of improving your health for today and for all the years ahead. And if you want to live your healthiest, longest life possible, you need to understand what's going on inside. At Inside Tracker, we take a personalized approach to health span optimization that eliminates guesswork from your wellness plan. Inside Tracker analyzes blood biomarker and DNA data, along with physiomarker data from fitness trackers like Oura Ring, to deliver personalized food, supplement, lifestyle, and exercise recommendations that allow you to take control and improve your health span. And for a limited time, Longevity by Design listeners can get 20% off at the Inside Tracker store. So if you're ready to receive a personal health analysis and data-driven wellness plan to optimize your body for the long haul, then it's time to start inside. Visit insidetracker.com/podcast to get started today. That's insidetracker.com/podcast to get started today.
Let's pivot to some things that we can all do and should be doing to improve our oral health, like going to the dentist regularly.
Yeah, so again, that's something exciting, maybe the most exciting part of this episode, because we scared you with dementia and the cardiovascular diseases and the short longevity and diabetes. But the question is, so what? What can I do about it? And it sounds like you can do a lot. So we will try to cover here a few intervention or improvement of the intervention that you're already doing in order to allow you to improve oral health and hopefully allow you to live better longer. So the first point that we would like to discuss is I heard a lot of people asking when to brush in the morning, before or after breakfast. That's a question that I used to ask myself, and I know that a lot of people are asking. So it's not, the answer is not very defined, depending on the condition. But depending on a different factor, we can provide you some information when to brush your teeth in the morning. So it depends whether you eat breakfast or you don't eat breakfast. It depends what you have in the breakfast. So some breakfast staples like orange juice, coffee, tea are acidic. And brushing your teeth right after eating or drinking acidic food can cause damage to your tooth enamel. So the American Dental Association recommend waiting at least 60 minutes after eating or drinking acidic food before brushing your teeth. So if you drink coffee, tea, orange juice, don't brush your teeth immediately after. What you can do is wait 60 minutes or brush your teeth before you eat your breakfast. If you don't have time to wait, as I said, it might be the best to brush your teeth before eating in the morning. And for those of us who don't drink coffee, tea, or orange juice, or eat other acidic food, brushing after breakfast can help you to remove food particle and plaque buildup while freshening your breath. So that's about that. Again, it's not a clear-cut answer, but as we know in a lot of things in life, especially in our complex body, are not clear-cut and depend on the condition of what you do. The
This is
second
a big
question,
argument in my house. My husband has to brush his teeth the second he wakes up, and he thinks I'm gross that I don't brush him until a little bit after breakfast. So it sounds like we're both right, actually.
it depends of if you drink coffee at or orange juice. But yes, but yeah. Theoretically, both of you are right. Then the second point is how long to brush. And I didn't know before I did the research, and I realized that it's 2 minutes. And then the question is, how do I know that I'm brushing for 2 minutes? And also, it's not only that. How do I know that I cover all the teeth in the right amount of time and also right pressure and all of that? So technology is here to help us. And recently, a few companies came with a smart toothbrush that connected to an app that literally I bought such a toothbrush a week ago. And it is a revolution for me because basically you brush your teeth and it's telling you, okay, move to the next one, move to the next one, show you whether you brush it enough time or not, show whether you applied the right pressure or too little pressure, show you if you're scrubbing or not. So I recommend such a toothbrush to someone that have a issue, a dental issue like myself, or someone that really want to live better longer, someone that really like the insert tracker user that really want to beat the odds and live to 120. Yes, and then buy such a toothbrush is also a nice toy. I like to have those toys. I have a lot of toys like that, like a smart
Mhm.
refrigerator or another. So it's cool to have it. It's definitely in the last week that I'm using it, and I feel that my teeth are much cleaner. But I think that even with a normal toothbrush or even normal electric toothbrush, you can do it. It will be a bit harder because you need to count, you need to train yourself, and so on. Then another question that we struggle with is, should I use a fluoride toothpaste? So here the answer is yes. It is recommended to use a fluoride toothpaste. Fluoride is what protect the teeth from a tooth decay that lead to cavities. Using toothpaste with fluoride is helpful to prevent decay and help you to maintain the MI in the tooth. So definitely, fluoride toothpaste is good to have. Another question that I assume that it's intuitive, but anyway, we'll respond to that is, should I floss and how often should I floss? So the recommended time is once a day. And it's help you, the flossing help you to cleaning between the teeth, help to remove food and remove plaque, which is also part of a good oral hygiene routine. And if you don't do that, the plaque can start to accumulate and permanent plaque that's called tartar that stay there, and then that can cause decay, gum diseases, and make you even painful to chew. And even at the end, they can cause tooth loss. So definitely it's important to floss at least once a day. Now, some people don't like to floss, or it's hard for them, or it's painful to floss. So there is a solution for you, and that's called a water prick or a water flosser. And it is pretty beneficial, and the benefit for that is allow you to have effective cleaning. It's provide a gentle and effective way to remove debris from the plaque. So similar to floss, but it's easier, faster, and user friendly. Also, another advantage of that is that it has an adjustable pressure. So if it's too strong for you, you can adjust the water pressure. And if it's not strong enough for you, you can adjust it higher. So definitely, water prick is something that I recommend our listener to use if you want to be better. I'm using it for a few years, and it's pretty easy and fast way to clean your mouse in a very short while of time. Another question is about mouthwash, and this one is a tough question because it's not a straight forward, and also there are different type of mouse wash or mouse rinse. One of them is the cosmetic one, and the other is the therapeutic one. The cosmetic one, basically, as we said, it's like cosmetic, like what you apply on your face when you want to look good. It's might prevent the bad breath and might leave a pleasant taste, but there is no effect, or you're not treating the cause of the bad breath or the non-pleasant taste that you have in the mouth, because it doesn't have a chemical or biological unit that help you to receive the benefit. But there are the therapeutic one have this activity, and it can basically control the amount of bacteria in your mouth. For a long time, actually up until recent years, evidence and expert opinion support the concept that removing pathogenic species from the oral cavity with a mouthwash should also constitute good oral hygiene. However, recently, we understood that it's not only the bad bacteria, but also the bacteria diversity. And it's very similar, as Ashley said, to the gut microbiome, also the oral microbiome. You have some good bacteria and you have a bad bacteria, and it's not only actually bacteria. You have fungi, you have archaea, you have protozoa, you have viruses. All of them are located in our mouse. You need to understand that our mouse is, when you open it, everything can go in. And also interesting about the mouse is that you have a different level of oxygen. So immediately in the mouse, you have like 21% oxygen, like what we have in the air. But in some cavity and other places, there is a lower amount of oxygen. So there is a different kind of bacteria or other creatures that live in a different location or different exposure of oxygen. And we need to understand that. As Ashley said before, we are not really understand fully what's happening in our mouse bacteria. By the way, I don't think that we understand fully what's happening with our gut bacteria either. So we have a lot to learn about that. And because of that, it's not clear whether a mouse wash is a positive or negative. The current recommendation is using it once per day is okay. I would recommend you to use the cosmetic one and not the therapeutic one when you use it without a dentist recommendation. If the dentist recommend you to use the therapeutic one, it's good. Usually you use them when you have a serious dental procedure and you want to maintain the mouse clean of bacteria as much as possible, but very similar to antibiotic that we use for the gut microbiome. It's not recommended to have to wipe out all the bacteria, because then you don't know which bacteria will colonize it first and whether it will be the good one or the bad one. And as I said, we don't understand yet which are the good and which are the bad. So the best advice is, if you want to use the cosmetic one, but don't use it every 2 hours. Use it once a day, and if you use it in moderation and not too much. So after this long discussion about what can you do, and as I said, you can do a lot. Ashley, you are an expert in nutrition. So can you describe about the influence of nutrition on oral health?
Sure. And this one, I feel like we're all more comfortable maybe thinking about certain foods that can have an impact on oral health. Definitely the foods and beverages that we eat can have a significant impact on not just our teeth, but also gums and overall oral cavity. Some things to think about related to nutrition, tooth decay, and cavities. I feel like I saw so many commercials growing up about sugary foods, super starchy foods, especially before bed. If you don't or if you don't brush your teeth, that sugar is really a food source for those bacteria in your mouth. So if there is a lot of sugar that's left on your teeth, those bacteria can eat it and produce acids that can lead to tooth decay. Ultimately, that's what can cause those cavities to form. So limiting intake of sugary snacks and drinks, and definitely if you're having them before you go to sleep, brushing your teeth to try and brush off that sugar before your more dormant period when you don't have as much saliva helping to wash that off of your teeth is important to reduce tooth decay. For gum health, the nutrient that's probably most important is vitamin C, other than, making sure you're eating a well-balanced diet that provides all of the vitamins, minerals, and protein. But vitamin C in particular is really important for gum health because it's required for the formation of collagen, which is a type of protein found in really, really high amounts in our gum tissue. We all have probably heard of scurvy, which is the condition caused by a deficiency in vitamin C that causes gums to bleed. This is incredibly rare for anyone in the United States to be super deficient in vitamin C, which we find in lots of products. It's been added, but also naturally in fruits and vegetables. But I did hear a few years ago about a case of a college student that decided to live just on ramen noodles, no fresh fruits or vegetables in their diet. They developed scurvy. So they had bleeding gums, bad gum health. So as long as your diet isn't 100% ramen noodles, you might be okay. Calcium and phosphorus are two that are important to essential minerals. for maintaining a strong tooth enamel. You can find those in a lot of products: dairy, leafy greens, nuts, all good sources of them. And including them regularly in your diet are really important to just maintain the strength and mineralization of your teeth. Calcium is not just found in large amounts in your bones, it also is in your teeth as well. And certain diets, like a raw vegan diet, might lead to not taking in enough calcium and can cause some of that calcium to be resorbed from your teeth back into your bloodstream, since all of those teeth are connected to your bloodstream. So that can definitely cause weakening. They can become much more susceptible to cavities as well.
So
And
actually, question about that, about the calcium. So postmenopausal women are more have a higher risk for cavity in that case.
I don't know if the resorption, actually, I don't know if there's research on that. In theory, perhaps, since the rate of calcium lost from the bone accelerates post-menopause, that'd be interesting to look if perhaps that's a connection that we also see. It's hard to tease out because, as you said, age is one of the factors that is also one of the biggest contributing factors to the development of that as well. But pregnancy is another thing that if your calcium intake is very, very low, usually during pregnancy, your body drastically increases the amount of calcium that it absorbs when you eat food. But if your calcium level is, or calcium intake is super low, you can't really increase that much not much can be absorbed if you're not eating that much. And there's also cases of women developing more cavities during pregnancy if their calcium intake is incredibly low. And you're growing all of the teeth and bones for a baby, and they're going to take that calcium if you're not eating enough of it. Hydration is another important one. Drinking water, as we talked about, saliva production is really important. We have some bicarbonate in our saliva that helps to neutralize acids from food. It helps to wash away those food particles, moistens our food, helps to lubricate the food as well as our oral cavity and throat for swallowing that. It also contains, saliva also contains some enzymes that help us start to digest carbohydrates and fats in particular, and then also has some of those lysozymes in it, which can kill more harmful bacteria. So preventing dry mouth as much as possible, having enough fluid in your day, enough hydration in your day is important. Acidic foods and beverages in moderation are probably fine, but knowing that more acidic foods might contribute to some of that erosion on your tooth enamel can make those teeth more susceptible for those cavities to form. As Gil mentioned, if you're having really acidic foods, maybe doing a mouthwash afterwards can help to minimize the impact on that. Vitamin D goes hand in hand with calcium. Your body requires vitamin D to be able to absorb calcium from the digestive tract. So sun exposure is a great way to make sure that your body is able to produce enough vitamin D. Certain foods like fatty fish or fortified foods, fortified dairy or non-dairy products are good sources. And then just overall balanced diet. You always have to put a plug in there for that. A balanced or varied diet that contains lots of fruits and vegetables, whole grains, lean proteins. Fortified dairy products or dairy products definitely can support not just your oral health, overall general health and well-being. As we talked about with cardiovascular disease, diabetes, and Alzheimer's, a lot of those are, it's a two-way street. So if your diet can help to prevent those things in some respect, can also be influential for maintaining a good oral health. And just important to note, poor nutrition can certainly compromise your body's ability to resist any type of infection. Also, that also applies to those infections in your mouth. How about physical activity, Gil? Any connection between oral health and physical fitness?
Yeah, so the connection is less strong as nutrition, but still there are a few points to consider. The first one is a nutrient absorption. So when you have a good oral health, it's easier for you to absorb the right nutrient that you need to absorb. But if it's not good, it will be hard for a person to absorb the right nutrients. So bad oral health might say bad absorption of the right nutrient that will allow you to have the right nutrient to perform the physical fitness and be in your top performance. The second point is the inflammation and the systemic inflammation. So oral health condition, particularly gum diseases, have been linked to systemic inflammation, and then that's called chronic inflammation in the body. And as you mentioned, increasing HSCRP. which is a marker that we love at Instant Tracker, and or love that when it's low. And that can negatively impact physical fitness and athletic performance. And we know that there is a correlation with very high inflammation and low performance, and maybe fatigue, and even you can get injured more. And the last point is respiratory health. So as we know, the oral cavity is connected to our lungs. And if you don't have a good oral health, that can basically spill into the lungs and cause some bacteria to get into the lungs. And this can potentially affect the respiratory function, which is critical for fitness, as we know. And actually, there is a systematic review that have done in 2020 that reported that poor dental or oral health negatively influence physical fitness, balance, and cardiorespiratory function. And there is another study, a cohort study that have done in 28 that look at the 2,000 older people in Japan and found that people with oral frailty were at risk of physical frailty, sarcopenia, severe condition requiring nursing care, and death. So basically, there are some correlation between oral health and physical performance. And I think that everyone should take it seriously. So if I'm trying to summarize what we learned from this AMA episode, is that oral health is very important. We've seen a very significant correlation between poor oral health and the shorter lifespan. We've seen also correlation between oral health and dementia, cardiovascular diseases, diabetes, and other diseases. We also discussed a lot of ways to improve the oral health. So again, it's not like I have a bad gene. It's I can come and say I quit, or I can come and say I can try to fight it. And there are a lot of tools in our arsenal to fight it and improve our oral health. And part of it is nutrition, part of it is lifestyle, part of it is maintaining the oral health. Definitely the dentist and the hygienist can help you with that. But in high level, nobody should raise his hand and say, okay, I surrendered, I cannot do it. You can definitely do it and try to improve your oral health as much as you can, because oral health, and it was surprising for me, and I think for you as well, Ashley, it's have a big impact on a lot of processes, diseases, and at the end they convert into longevity, poor oral health equal low lifespan or a low end span. And all of us want to live better, longer.
Yeah, and there's so many things within our control, as you went through, that we can do to have a positive impact. Dentistry, they did it. They did a great job of first goal, keep teeth in people's mouth. And now it's nice to see how some of the research for dentistry is shifting to not just, I think they've got it. Go to the dentist, take care of your teeth. Your teeth will stay in your mouth a little bit longer. Now we can see how all of the other things in that oral cavity, taking care of them, can have a bigger impact on overall health and longevity too.
Yeah, no, I agree. So I think that we can finish here, and thanks our listener to listening to this episode. And thank you so much, Ashley, for co-hosting this episode with me. And I want to thank our a new producer, Gavin, for helping us doing the research and finding this fascinating information. And I hope to have you guys coming and listening to our future episode and past episode, and enjoy the wealth of information that's available in the scientific community that we are trying to communicate to you. Thank you so much.
Hi, everyone. Welcome back to Longevity by Design. I'm your host, Ashley Reaver. This episode is an Ask Me Anything between Gil and I. In this episode, we explained what oral health is, its importance, and how oral health is related to overall health, well-being, and longevity. We also discussed the oral microbiome and what is currently understood about it. And we delved into how oral health is linked with cognitive health and diseases such as dementia and Alzheimer's, as well as cardiovascular disease and diabetes. We learned a lot. We also discussed some key things to do for oral health and preventing oral diseases, as well as the influence of nutrition on oral health and the intriguing link between oral health and physical fitness and function. This episode was really fun to record, answering some of your questions. Thank you for your continued support, and don't forget to rate and review the podcast.
Thanks for listening to Longevity by Design. Please subscribe to this podcast on Apple, Spotify, or YouTube. Longevity by Design is powered by Inside Tracker, a personalized health optimization platform that helps people improve their lives by improving their bodies from the inside out using personalized, science-backed recommendations for nutrition, supplements, and lifestyle changes. To learn more, visit insidetracker.com/podcast.